Everyone who are here and today we cannot forget since the worst. It is in the 50th year it has given name and fame to the group of SRM. Today in this state or globally country, it has created a wonderful name within a short span of 4.5 years. We are in the 50th year. Really speaking, we are going to touch 1 lakh surgeries this year. It is not an ordinary achievement for a hospital to compete with the grown people who are along with us in this industry. It is possible because of our doctors, the heads. We have our 9 institutes. Really, I have to hats up to my team and my doctors. I can never forget. The concept of SIMS is not only a hospital. Every person in the hospital is having their care to the patients because we are not seeing commercially. Of course, anything has to be commercial, to be there to run the institute or the business.
More than 4 decades and scored more than 5,000 runs in tests.
People what they say and what they write. But thank you very much inviting me, giving me this opportunity to become a little more knowledgeable about your own body. I can only say it happened to me almost 3-4 decades ago. When I was a young kid, I injured my knee and I had an open knee surgery. Way back in 80s, they didn't have this instrument. They didn't have technology. The doctor was just have to open the knee and see what's wrong. Today they don't have to do that. And I remember I was an intelligent boy, just my knee was hurting. And they said, okay, let's see, they removed the cartilage. 30 years back, I come to know they didn't supposed to remove the cartilage, they just had to shape up a little bit more with the technology help, and I would have been all right. Had this technology there, I would have played another 5 to 7 years cricket. Disappointed why you come so late. I would have definitely played more cricket or done better things. I had 4 knee surgery. Luck would happen. Always I done a knee surgery when there is no cricket. So I was lucky I could carry on playing cricket, but technology always helped, I believe that. And that we've seen on the cricket field today also. They come to know what the bowler is doing, how they have to bowl, where they pitch, what is the weak point, what is the good point. But I think technology is good. But behind the technology, the person is more important. I never ever believe technology can improve you until unless the doctor behind that, or the people who are working behind that, can be really put things at the right place. And I can say that definitely I need another knee surgery, or maybe knee replacement where I can run again, or I can play golf again. I still play, but not so much because knees start hurting. But I must say that to you people, all of you, well done. You started, the beginning is happening here in Chennai, which I always call Madras. It's wonderful. I hope you can look after the people who need it. But so many people need knee replacement, a little worried about that. I think we have to be good, we have to look after ourselves. The last thing I expect people go to the hospital, the last thing. I think one shouldn't go to the hospital if you look after your life properly. But if the problem comes, the doctors are there, and that's very good. And I want to wish you and to your entire organization all the best, good luck. But have a complaint, you should have been here 30 years back. And again, Happy New Year, and wish everybody this year we bring more happiness, good health, where we shouldn't reach to the hospital. If at all goes, there are a lot of intelligent doctors sitting here who can look after you. Thank you once again for inviting me and giving me opportunity to come here. Whenever I come to Chennai or Madras, I always feel very happy. This is the one place, whenever I play cricket, I never done wrong. I always done good. If the media wouldn't have been there, I would have said a couple of things, because I'm worried about saying a couple of things, the things travel back home. So thank you very much and all the best, and Happy New Year. Hope this year brings more happiness and a shine on everybody's face. Thank you once again, inviting me.
No, I have not had my knees replaced. Actually, the bond with SIMS is not of the joint, it's of the heart. The most important person to us in all our lives is our mother. And I brought my mom here almost 2 years ago to replace her knee. She did one of her knee replacements in Mumbai. And to be very frank, even though the media is there, she was not happy. So she decided to do the second one in Chennai. And when I got her here, and we chose SIMS Hospital, Dr. Suryanarayanan, Dr. Ashok, and definitely the person who made it very smooth, Prema. So these are few names that I can just immediately recollect. There were many of them, it was an entire team. And it was the most beautiful experience. Why I'm saying this, why I'm genuinely saying this is that because everything about the hospital, it's not, I mean, every doctor knows the craft, every doctor knows how to replace the knee. But it's the special care, the care post-surgery, which matters the most. Small example of very small things which make a difference. One being the beds. As a child, whoever in family has been to the hospital, I have seen that, when the surgery is over, or during surgery, they put them on this cloth, and then they are transferred to the operation theatre, and then when the surgery is finished, they put back on the cloth. But something about SIMS, I found it so updated. The beds, you know, when the patient has to be shifted from the surgery to the surgical room, the bed would, you know, they didn't have to pick them up and put them, they would just, the bed opened up and, you know, they would just slid onto that, and especially post-surgery slid back. So everything, the minutest comfort was given to my mom. And, you know, if genuinely I didn't feel this, I wouldn't be here. When they asked me to come for this function, I said, sir, wherever I am, I told Dr. Ashok, I want to be here for this. And I just got back last night from my New Year vacation with children and family, but I really wanted to be here for this because my mom is a free-willed person, and she's been, after her knee surgery, she has been roaming the world. And you know, two things she doesn't want to give up is roaming and seeing the world, and her sweets. She's highly diabetic, but these two things she doesn't want to give up, and she's having a blast. Another very important reason why I said that I connect as it's a heart connection is my husband runs a foundation for educating children, the Agaram Foundation. I think everyone knows about it. And SRM University has given a free medical seat for Agaram Foundation, and one of Agaram's first medical student passed out because courtesy to SRM. And he belonged to a refugee family, Sri Lankan refugee family, Nagaraj, and he has got past his medical seat because of the free seat given. Thank you, sir. Thank you very much.